Okay, I believe we have a quorum. And I'm going to call the meeting to order. Approval of the minutes. You'll all receive the February minutes. Any additions or corrections? Okay, a motion to approve the minutes?
So moved.
Second?
Second.
All in favor?
Aye.
Opposed? Minutes are approved. Thank you. And the health officer report?
All right, I think you have a copy of my report in your papers. COVID's decreasing across the country and across the state as well. When they test wastewater concentrations, the Indiana Department of Health says it's currently lower than at any point during the month of February. COVID rates in Wayne County are up about 50% from this time last month. However, it's still below the state on overall incidence. There weren't any new COVID deaths reported in Wayne County in February. Respiratory syncytial virus, RSV, is currently dropping across the country and is very minimal in Wayne County. Influenza is up about almost 300% from this time last month, which brings us just below the state incidence rate. However, the state's currently seeing the highest rates of influenza-like illness, emergency department, and urgent care visits we've seen since 2019-2020 season. But we're still, our influenza-like illnesses are about half the state's rate at 1.9 and 3.2% respectively. The CDC has updated their guidance on what to do with respiratory illnesses and COVID, and that is it's just 1 day of isolation, and you can be around others once you're fever-free without medication. Your symptoms are getting better. They also suggest that you distance yourself from others and wear a mask. The CDC recommends that people that are 65 years or older receive additional COVID-19 dose. They do need to wait for 4 months after their initial 2023, 2024 dose to get their second dose. Indiana was notified of their first confirmed case of measles in Indiana in February. This is probably the most contagious of all viral diseases and virtually disappeared in 20 years ago because of vaccination, but now many people are against vaccinations, not vaccinating their children, getting religious exemptions, so we probably will see episodic outbreaks of measles in other places in the United States. And that concludes my report. Are there any questions?
Just a comment, I did see an interesting comment, is that next year they're recommending that we go to a trivalent vaccine for flu instead of quadrivalent. And the reason for that being is the group influenza B that had been in the quadrivalent disappeared during COVID. The COVID restrictions got rid of that particular strain, which kind of makes sense because early in COVID we were following flu-type recommendations for trying to control the epidemic. So it did control, it wiped out that one strain of influenza B.
That's amazing. Well, you know, the whole, we didn't have a flu season that year.
Yeah.
No one got the flu, which was amazing.
So.
The
COVID for over 65. For instance, I think I had one in October, it would have been the booster type thing. Is it
You should get another booster.
another one's, there's been a 4-month interlude?
Yeah,
Okay.
I'll keep an eye on you, Ron, because we can't lose you.
Yes, you can. Show up someplace else.
Okay. Clinical director report?
Okay, so, one of the requirements for Health First Indiana was to submit our baseline data at the end of February. So I got all of that data submitted to the Indiana Department of Health's new data tracking portal. The data that they are collecting is pretty lengthy. I wasn't expecting it to be quite so lengthy, so that was an interesting process and kind of good introspection for me to see kind of what they're expecting data-wise as far as what we're gonna be expected to be collecting biannually moving forward with Health First Indiana. The next update with Health First Indiana is the contracting documents that we went over last month. I made some updates too. So the first one that we have to look at here is the dark blue tab, and that's the contract program guidance and proposal information. So the main thing that I updated in this one is on page 5, and that's the timeline. So last month you guys made a motion to approve the contract end date for December 31st of 2025, but we have yet to kind of determine if we like the remaining dates that are on that table. There is a requirement with Health First Indiana and the Indiana Code with SEA 4 that it does have to be posted for 30 days. So I've got that requirement built into this time frame. But I kind of want to see how we like this, and then if you guys are okay with it, then we can go ahead and move forward with our request for proposals for our contracting dollars with Health First Indiana.
How familiar are agencies that might apply that this is going on and happening and?
I would say since we kind of publicly made agencies aware that we were opting in last September, I've probably met with 15 to 20 different agencies that are kind of asking, do we meet the KPIs? Are you going to be giving out money to build up other agencies? Because I think that's, Indiana Department of Health has kind of made that public knowledge, that this is not to expand the employment base of the health department, but more so to build up the community agencies and kind of expand services within the entire community. So I would say somewhere between 15 and 20 agencies that I've worked with. Dan and I have kind of talked about how we would advertise the request for proposals. The Indiana Department of Health did develop the contract posting portal because of the 30-day requirement. So we would essentially post these documents to that portal, and then from there, I guess we would determine if we need to do further advertising.
So if we pass this today with these dates,
Mhm.
then you'd be able to put that in effect, and it would basically, you start your 30 days with me, would be kind of mid-April is when that
Mhm.
30 days would be up.
Yeah,
And it would give them, organization, maybe 6 weeks
yeah, a little bit more time.
to work on this.
Mhm.
Are people comfortable with that timeline, or do you think it should be a little bit later, or?
I reviewed this with Becca and Dan. I like it. It gives us 2 weeks to review the proposals, and the notifications the next day, which I think it needs to be timely. And then a 2-week period to issue contracts for signatures. And then the award period will begin on June the 1st. So
Okay, so we need to have a board approval in there, I'm assuming also.
Yeah.
yes.
So,
I'm also on the commissioner's agenda for tomorrow too, to seek approval for that from the commissioners.
okay. We need to keep in mind that we've got other bodies that need to meet to approve.
How many steps are there in the approval process, or who all has to approve it?
As far as I understand, it's the board and the commissioners.
Okay.
I'm not for sure about the council. I
County,
need to look
okay.
into that.
So do we look to see when in May that's going to be?
I've got the roster on the very last page in your packet, and that's got the dates of the meeting on it. So that would be May 21st.
The commissioners will be the 22nd. So do we need to move that award notification a little bit? Back to the 24th?
Yeah, I think we could do that, time frame wise. I think that would work, and it makes sense with the board meetings and the commissioner meeting. Okay. You said May 24th?
Right.
Okay.
So then it'd have to be 24th to 31st for signature.
Mhm. I think that would be enough time. What do you think, Dr. Jetler?
I think it's plenty of time.
Okay, other comments?
When is this gonna be public then?
So it would be, it could be posted anytime once
So
it's
tomorrow
approved,
or
after the
next week or-
commissioners approve
okay.
it.
I'll entertain a motion to approve it as amended.
I'll make a motion to approve.
Or a second?
Second.
Okay. Other comments, questions? All in favor?
Aye.
Aye. Opposed? Motion carries.
The next thing is that the 2025 Health First Indiana budget is due on June 1st, so this year. And so there's some things to consider with that. Mainly, so our budget amount is gonna increase in 2025 from the state. And so we could be funded anywhere from about 1.6 to 2 million from the state. And then the county only has to provide us a 20% match. And so that's somewhere between about $320,000 and $420,000-ish. Either way, the total combination will be higher than the total combination of the Health First Indiana and the county funding from this year. But the reason why I bring it up and the reason why we need to kind of think about it is because currently almost 70% of our county employees are funded through county dollars. And so if our county funding is gonna be cut in half due to our state funding increasing so much, that's something that we kinda need to consider. So I was gonna ask for, because the budget is due June 1st for the Health First Indiana funding, that means I would present a draft to you guys in April, make whatever changes you wanna see, and then present the final version in May. That way it could be approved and submitted by June 1st. So I wanted to ask if you guys wanted to have me present a budget for both scenarios of kind of our typical county funding number, and then also more of that, like 20% minimum match, and maybe a continuum of all the numbers in between.
Okay, so what does that mean if the county pays less and so we can't fund
It doesn't mean that we
Our
can't
employees.
fund it, it just means that, so, for example, this year, total between county funding and Health First Indiana funding, we had a total of about 1.6 million. Next year, total between county funding and Health First Indiana funding, we're gonna have somewhere between 1.8 and 2.1 million. So we'll have more money total, but the money from the county is likely gonna be less, and so we'll have to just move county salaries from the county funding over to the Health First Indiana funding. And because the Health First Indiana budget is due on June 1st, I'll just have to have an idea in my mind of if I'm gonna be funding those personnel salaries out of the Health First Indiana funding instead.
So it's kind of like a financial shift, is that, I mean,
Yeah,
pretty much?
yeah, we'll be able to pay for everything that we were paying for before.
But how does that affect things like insurance for the employees and retirement plans and?
The dollar amount wouldn't change, it would just be the fund that changes.
But they'd still,
And it'd still be county employees then?
Yes, yeah. Yeah, so right now we have $605,000 out of our $827,000 with our county money that is personnel. And so if they're only required to give us $420,000 and they only give us $420,000, but I have $605,000 in personnel, I'm gonna have to move some of that personnel over to my Health First Indiana money, but they would still be county employees.
so there's no adverse impact on the county or the
Mhm.
employee?
No,
There's no change in status of the employee,
No.
just the fund that the
Just the
employees-
budget, the
some employees
improved,
will be
yeah.
compensated from.
yeah.
I don't know why we'd have to have both if there's no adverse
Yeah,
impact.
I would think so either.
Well, just because of the budget being due on June 1st, I wanna make sure that the budget that we're approving on June 1st is accurate. But we can always make budgetary changes down the line if we need to, and Indiana Department of Health's usually pretty flexible with that if we need to. But I can have some conversations between now and next month to kinda see if, they anticipate cutting our funding down to the 20% versus what it's typically been.
Once you get a clear idea, make sure the auditor's office is clued in.
Okay.
I guess if it's in doubt, then we should have both, but if there's agreement on how it's going to go,
I think I know how it will
go, I think I do.
Which is understandable, I mean, I can understand it, there's other projects that cost a lot of money. Okay. So, you have a copy of the AmeriCorps MOU in your packet, which is, let's see, pink tab. This is the one last month that I asked for retroactive approval for, but didn't give you a copy of, so now you have a copy of it. Sorry about that.
Okay.
And then all this is just, the Health Foundation of Greater Indianapolis pays to host or fund, AmeriCorps members, and part of what they like for their AmeriCorps members to experience is syringe exchange. And so Wayne County currently allows one AmeriCorps member to come to our syringe exchange on Tuesdays at the health
You
department.
say it's in our packet?
It is, yeah, it should be the
Pink.
solid pink tab.
Kind of toward the back.
I don't have a solid pink tab.
Let me see, you can have mine.
You can have mine too.
Oh, yes, so I guess I downloaded it. I think there's some confusion in the term of the agreement.
Okay.
The way it's written, I think it's already expired.
That's what, Dr. Ryder mentioned that to me when he was walking in.
It's on page 3, under item 4.
Yeah, I had a copy of it, I downloaded it. What Brittany sent us.
Where did you say it's at?
It's on page 3, under item 4.
And the preamble paragraph has a November 28th date, but it doesn't have a year, I don't believe.
Page 3, item 4, the MOU has initial term commencing its execution and ending on, okay, yeah, you're right. I'm sorry about that. Okay. I will contact them and see about getting an update.
Apologize, I didn't look at everything very thoroughly. I had this down on my calendar for next week's.
That's
talk.
okay. Sorry
So
about the
Jeff called me.
change. Okay.
I think it's a technicality because the date that we entered into the agreement with them was in February of this year. I think just correct that, but I don't think there's any objection to us having an AmeriCorps volunteer.
Okay.
Modify the preamble in paragraph 4, yeah.
Do you wanna do, I don't know if I'm allowed to ask this, I guess, but like approval pending the date change? That way I don't have to bring it up
Well, I
again?
think we could just have just entertain a motion to approve it with the date change.
Okay.
Yeah. So moved.
Is there a second?
Second.
All in favor?
Aye.
Opposed? Motion carries.
So then, I have some brief financial updates for you. Let's see. First, I wanted to mention, after the comments from the auditor last meeting, kind of in good faith, I did schedule a site visit with the Indiana Department of Health financial analyst. So she's gonna come on March 18th. Okay. Kind of look over our processes, our accounts, our, just kind of everything to make sure that we're doing things the way that we should be. It would make me feel better, and then I'll kind of have her write a letter or some sort of report that I can present to you guys after
This
that.
is from the state.
Yes, Indiana Department of
This is not
Health.
from the firm he was discussing.
Correct,
This is
yeah,
from the state.
yeah, yeah. I conveniently, I had a meeting that she was in 2 weeks ago or so, and so I just asked if she'd be willing to do that, and she said absolutely, so, that is coming up here soon. Just some, I'll give you some brief updates as far as, not so much general things. So, the Indiana Department of Health applied for a CDC grant for additional harm reduction dollars. And they were kind of just sending us emails saying, we don't know if we're gonna get it. And then they did get it, and so they gave us an additional $73,000 for our harm reduction services. We also got an approval letter for the local health trust, local health maintenance carryover request that was approved, I think in January here. I submitted the renewal for our immunization program, and our vaccine management plan was approved with our site visit in December. And then that's it for as far as specifics with each one of those programs. Just kind of as a reminder for that local health trust, local health maintenance, that was some additional harm reduction dollars, and then additional dollars for linkage to care, which is one of our new KPIs. For kind of a brief update on finances, our immunization program, grant cycle is July 1st to June 30th. That was about $115,000. So we're about 3/4 of the way through that program, and we're about 50% spent in that fund. One of the things with our renewal that I had asked for was a new freezer refrigeration unit that was about $18,000. And the department director had mentioned in a meeting last week about trying to find ways to cut costs with the anticipated 2025 costs. And so I had mentioned that since we're only 50% spent, the 75% of the way through the cycle, that we could use some of our current funding to buy that refrigeration unit instead of in 2025, if that's something that they were interested in making a budget adjustment for. So he's gonna get back to us on that. For our HIV prevention program, which is now 2 separate accounts, our HIV prevention account and then the local health trust account, we have $212,000 in the HIV prevention account initially. for January 1st of 2023 to July 31st of 2024. And we have about $75,000 left in that account. And then we haven't spent any of the local health trust money yet, and that's $104,000. So total, that comes out to $316,000, and we've got so we're about 50% spent out of those two accounts combined, with much less.
How much is the HIV account?
212 is where it started,
Okay.
and then we've got about 75 left, and it's got, what is July to March, 4 months left. Harm Reduction Community Fund is the fund where we get a $30,000 donation from READ every January. We did not spend all of our funds from them in 2023, but we have spent a decent chunk of funds so far in 2024, so we're just under $30,000 total in that account right now. Our clinical services account, that's our 340B program. That one changes a lot because of large claims with hepatitis C money, but that one is at about a $600,000 balance. Hepatitis C program is changing. That's the contract with our contract pharmacy that we had talked about. I think that was in January, where we're no longer going to pay in advance for the hepatitis C medication. They're still working on a few of their managed care entities. So I do have, I don't know, $20,000, $30,000 claims that I have to sign on occasion, depending on which entity the patient has. But for the most part, we are not paying out of that account right now.
Not as often as it was.
Yeah. For our lead grant, that one is July 1st of 22 through June 30th of 24, and that grant is not going to be coming back. That's being worked into the new funding, the new KPIs. And that was the one we talked about last month that had a part-time public health nurse and a part-time environmentalist into it before. It was about $125,000, but it's a reimbursable grant. We're waiting on, I think, a little bit of reimbursement for that grant. And I moved that part-time public health nurse position into our new immunization program. So once we get approval for that program, then I'll be submitting a request to hire for you guys for that position. And we did not spend anywhere near $124,000 with that program. Safety Pin is brand new, just started March 2024. We have a total of $300,000 for that program, also reimbursable. Ron, I've sent you 2 contracts for that position. They were just adjustments made from the physician assistant contract that you had drafted a few years ago. So we'll have to get those posted. We're allowed to use the Health First Indiana contract portal for that, so that's kind of nice. And Dan and I had kind of discussed if we want to do additional advertising with Indeed, or what's the other one, Monster or something? So I think because of some other maternal and child health programs across the state losing funding, unfortunately, I don't think that we're going to have a hard time filling those positions. But that one has just started, so we haven't spent any money out of that because we haven't filled those positions yet. Our FEMUR program, that one started in October of 23 and goes through September 30th of 2025. We have spent very little out of that one. That's a $263,000 grant, and we've spent about $15,000 out of that one, mostly our registered nurses, FEMUR coordinator's salary, also reimbursable. Emergency preparedness is July 1st, 2023 through June 30th, 2024. That was a $25,000 fund, reimbursable. Very particular on what we're able to spend money on that one, and that one is spent, right, with the AEDs, or will be?
We're very close. We're buying signage for EMA for the fairgrounds. We're helping the sheriff's department out with AEDs. I think that would bring us to within $3,000 or $4,000 in the next amount.
All right.
But we don't plan on redoing it in July.
Yeah, we have a few pending charges on that one, which is why it's not spent, but it's appropriated, or it's ready to be spent. Our school liaison grant. This was a $330,000 fund from July of 2023 through June 30th of 2024. This one's a little bit different than a lot of our other programs because it's not reimbursable. We actually receive a lump sum every time we turn in our deliverables that are quarterly. And that fund is up to about $230,000 right now. It was initially 2 FTEs is what it was written for, and we've only had 1 FTE for a while. So I'm considering making a request for hiring another school liaison. We only have 1 school liaison, it's contract, built into the Health First Indiana funding to start in June. And so my thought process was, if things kind of move around, depending on how the contracts shake out and all that, our current school liaison could train the new school liaison because we have so much funding in that account. And then our current school liaison would transition to potentially a new position pending what kind of happens in June with our Health First Indiana contracting. But that's kind of a conversation for another time. But there's a lot of money in that, and that grant ends on June 30th. That money can be spent on any sort of like public health related support for the schools. We just don't have the staff to go out and do the programming right now because we're a little bit short-staffed with all the other programming that we're doing. And then finally, nope, not finally, sorry, I have a few more. COVID reimbursement fund is the administration fee that we receive for administering the COVID vaccines. Before the COVID vaccine commercialization, we have about $160,000 in that fund. The COVID vaccine was commercialized in 2023, October of 2023, so we're not receiving any more money into that fund, but that is to be used for medical supplies, catching kids up on vaccines when they were in quarantine during their primary vaccination times and things like that. Let's see, our county general fund, that one budget is $827,000. That's the one I was talking about before with all the personnel, and we're sitting right about $800,000 in that one right now. That one's till the end of the year. Health First Indiana, that one budget is $803,000 and kind of tracking along the same way. Spent exactly how it's supposed to be so far, aside from all of our contracts that we'll get running up here in June, hopefully. And then our health donations account doesn't have a specific time frame on it, has about $6,000 on it. And I have it appropriated for things like logo wear, employee appreciation, and then food for different programming, things like that. Okay, I know that was a lot.
What schools are served by the liaison now that we have 1 FTE?
So all of the schools in the county.
All?
Yeah, you may know the number better than I do, but I know that he goes to all of the elementary schools. He goes to Friends, he goes to Seton, he goes to Centerville, Cambridge, Fountain City, or not Fountain City, Centerville, Cambridge, Northeastern, yeah, thank you, all of them, yeah.
It's a big workload.
I wanna say it's like 20-something schools total with all the elementaries and everything, so it's quite a bit. So if there's no questions on the financial update, I've got just some general program updates. For our fetal and infant mortality review program, we filled our part-time position last month, and our community health worker for that program started, and she's doing an amazing job. She and our FEMA coordinator are really hitting it off. They're doing some new marketing campaigns, kind of coming up with some new information. That program can be a little bit sensitive because they're trying to reach out to women who've lost their babies in the past, and so they're doing lots of new ideas that are really cool. Safety pin, the only update on that is just that it's newly started March 1st and that I had drafted up those independent contractors for review by Ron. Harm reduction, we had an Indiana Department of Health state site visit last week, which went really well. The only thing that they recommended is that we do some surveying of our syringe exchange program participants. So they're gonna give us some ideas on that. And then I also met with the Health Foundation of Greater Indianapolis, their vice president, and then the director over the harm reduction program. And they're interested in finding out more about our hepatitis C testing and treatment program, and then teaching other counties about it. So they had asked about coming and meeting with us, meeting with our physician assistant, to learn more about that so they can teach other counties about it. The lead program, at the state, there's been a lot of turnover in the lead program. And so with the new program coordinator, we did an entire caseload review for all 63 cases that we currently have open in Wayne County. And we were able to close quite a few cases because there was some misunderstandings on some of them for why they were still open between our public health nurse, risk assessor, and their staff. We also gave some feedback as far as their system and kind of making things a little bit more efficient. So that was good. That was a really good conversation.
How many lead cases did we end up with that you eliminated?
I think we closed 8 cases, and then transferred 2 to different counties, so a total of 10 less, so 53. And that number is elevated because of lowering both the blood lead level and the environmental lead level within the last year.
Do they get eliminated because their blood level of lead comes down to normal?
They can, yeah, that's.
And the other one is their environment is been
Mhm.
treated in.
Yeah, they can also sign themselves out of the program. I don't think that happens very often, but they can sign a waiver that says, I'm not gonna participate in the program.
Most of those sites, non-owner occupied, it's
Yeah.
mostly rentals.
Mm-hmm, yeah,
Also, they can move out of jurisdiction,
yeah,
move from here to Indianapolis, and it kind of takes it off us, and at least the child, leaves the house to us to deal with, but as long as the child under the age of 6 doesn't occupy it, we can't enforce it.
mm-hmm. Okay. Dr. Jetmore talked about the new, COVID vaccine recommendations. We are planning for kind of a slight uptick in our COVID vaccines, just because a lot of people were vaccinated with the COVID vaccines between October, November, and December. So we know kind of 4 months, and with the new recommendations released that we might see an influx of COVID vaccines. And I've gotten a lot of calls too about people asking if they're eligible for their second shot. So, and that is gonna be a yearly recommendation. So for individuals 65 plus or considered to be immune compromised, they'll be getting 2 COVID vaccines yearly that are 4 months apart. Okay. Our current school liaison is going to be getting his insurance navigation license updated, his Stop the Bleed certification updated, and he's going to become a certified CPR instructor. Those are the updates with our school liaison grant. Dan, your turn. I think that's all I have. Does anybody have any questions? Sorry, I'm long-winded.
Take it away, Dan.
Mine won't be near as long.
We want more detail.
For a couple that help new board members, I don't think we've met. My name's Dan, I'm the environmental supervisor. Amanda, I know we've met, but, so I did an audit of our website not too long ago, and I need to update profiles. So if you guys want a profile on the website, you have one, but no picture. So if you want a picture, send it to me. If not, no big deal. If you guys want bios on there, let me know, send them to me, and I'll put them on our website. So the first thing I'm gonna go into is the septic program. So we've discussed this over the past year quite a bit with new legislation coming out last July. So what we're getting into now is holding tanks, and they are becoming more prominent. So if you see a document I sent you, it's got some weird highlighting on it from a PDF form.
Blue tab.
Yeah, I lost the sheet. I sent it over. I went to mess with the partitions,
I
laid the
noticed you
sheet
didn't have
down,
any
so.
tabs on yours,
yeah.
so I was fully ready. Light blue.
All right, so the first page of that document that I have somewhat highlighted just goes over what it means to have a holding tank, what a holding tank is. And then on the second page, about halfway down the highlighting section, it says to obtain a permit, the owner of the holding tank must enter a written contract with an operator of a septic management vehicle, which is a sewage hauler, providing the removal of the septic from the holding tank at regular intervals. Then they have to provide a copy of that contract to us as the health department. Then they have to commit to providing us copies of receipts that they've been actually pumping their tanks, instead of dropping a sub pump down there and pumping it out into their fields. So with that said, I want to change the fee ordinance. So the fee ordinance is a two-part thing here. So a couple years ago, we had some software that was that we bought into. It didn't end up working out. It wasn't conducive to our practices. They didn't basically what they promised us. They didn't hold to that. And to keep that program up, it's going to be too expensive. So when we had that programming, we took the fees, the permitting fees for septics, which was $400 for new construction, $300 for replacement, and $100 for repair. And we broke those up into stages of payments, 25, 175, 275, and then 100 and 100. So what I want to do is basically revert back, just to one single payment per permit style. I can't keep track of all these payments coming in without software to help me. So if it's just one single payment, again, I can keep track of that and I can monitor that, and we can still put onto our financial reports. So that's the first part is what I'm asking. It's not gonna cost anybody any more money or any less money. It's the same money coming out. It's just a one lump sum again. So I've spoke to a few of my contractors, and they actually prefer it. They prefer the one payment system. So that's what I'm asking for on the first part of that fee ordinance. On the second part is introducing a new fee for holding tanks. And what I'm asking for is $100 per year. That covers the application process. That covers me or another inspector going out to the site initially and inspecting the tank to make sure it's set at the correct depths, the alarms are set, they're wired correctly, they're on 2 different circuits, all that good stuff. And it also requires the yearly follow-up on the receipts, making sure that their hauler is an IDEM certified hauler, and we renew that every year in January. It'd come due for $100. Is there any questions?
Okay, now I assume there's gonna be a savings if we don't renew that software program.
I don't know about a savings, because it didn't come out any of our budgets. It was covered out of IT's budget. They're the ones that paid for that every year. So savings for them, yes.
But you said the program just didn't serve our purposes.
Did not serve. So GeoPermits was the name of the program. When they first brought it to our attention and pitched it to us, they said it would link in with our GIS. So that means if you got onto GIS or Beacon Online, that you could actually see permits and all that stuff. It never did link up with us. The reporting was horrible on it. If I wanted to type in 23 permits, how many I issued for subsurface systems, I couldn't do it. I ended up having to call them and ask them. I could find it quicker on a piece of paper because I keep backups on paper. So it was confusing to homeowners. Every homeowner that applied for a septic permit had to create a username and login. We all know how that is. Nobody wants to create another username and login. So we got complaints on that. The billing part of it, if you went in and where the payments were broke up, you made a $25 payment, and then the next payment, let's say, was $175. You've paid $200, so your third payment would be $100. But when it looked up, when the customer looked at it, it still showed that they owed $300, not the remaining $100. So then I would constantly get calls on that, and I would have to correct it, and I'd have to go in on my end and correct it in the system as well. It took up a lot of my time. I've been building that system since 2020, started on it in 2020, and it still wasn't complete. And that's just the septic program. We had monthly meetings. It took a couple hours each month for me to get on there and have them make corrections and all that good stuff. Just wasn't good money. Good money spent.
Other questions?
The $20,000 bond that's not changed.
That's a whole different subject, Ron. So I just found out today, actually, I can't charge a bond anymore. So with legislation out there, I don't have the bill number with me, but so I've submitted, if the board remembers last year, towards the end of last year, I submitted a septic ordinance. The board approved it, And then when I sent it to the state, they rejected it. They told me it was too restrictive and mirrored code too much. So I've submitted 4 more revisions to them, and each time it gets kicked back and tells me it's too restrictive or mirrors code. The last one I sent was literally a page and a half long, and it was only for contractor registration. It got kicked back again because now I'm not allowed to take insurance bonds. So there is no consumer protection anymore. That bond was initiated to protect the consumer, the resident, in case something happened to the septic system itself. That $20,000 bond covered the septic system. You know, if they knocked over a shed or something like that, that fell under their liability insurance, but this bond was particularly for that septic system. A septic system right now is between $20,000 and $30,000, and if you're sitting on an acre to an acre and a half lot, there's most likely a good chance you don't have enough room to put in a secondary system. There's just not enough land. So that $20,000 helped protect some homeowners from instances like that. So yeah, it's a new sore subject for me right now. So I really, at this point, I'm kind of lost. I don't know what to do because I've tried everything. The only thing I would like really as a person that regulates this is to really just know who's working in the county. You know, that I don't have somebody floating in from Gary, Indiana, installing a system. But right now, I don't have any recourse to stop it. So yeah, there is no septic ordinance. We're following straight code, which is fine. The code clearly states out, well, you know, what is to be and not to be. No different in the holding tank here. We see that maximum's 10,000 gallons. The floats have to be set at 2/3 full. They have to have audible and visual alarms with separate circuits. I mean, it's all laid out in code. So I really don't think we need an ordinance to regurgitate that. But I think we do need something with registration, and I'm finding a hard time getting that through the state's TRP. This legislation took place last July. July 1st is when it took place. And we're sitting at mid-March right now, and the TRP for the state of Indiana has not approved one ordinance for the whole state of Indiana. So there's not a county in Indiana right now that has a septic ordinance. That's how strict they are.
Okay, is there a motion to approve the proposed fee schedule?
So moved.
Second.
Any further discussion? All in favor?
Aye.
Aye. Opposed?
Thank you.
Old business? Any other new business? Comments from the public? Well, it looks like the date for our next meeting will be April 16th. Entertain a motion to adjourn.
So moved.
Is there a second? Second. All in favor?
Aye.
Opposed? We're adjourned. Thank you, everyone.
April 16th.